what are some signs that it would be appropriate to raise the dose of a PAH medication? What tests would a specialist do to watch out for disease progression?
Really good question. I appreciate that, because this is the piece where you start to really be able to, I think, advocate for yourself as a patient or for their caregiver, because what I try and help my patients understand are what are those signs that might make them more aware or reach out to their provider. And so I think there are different signs that might indicate that there's a concern that our patients aren't where we need them to be or responding as well as we would like them to. So some of the signs that an individual may feel, so more of their symptoms, might be that they were having increasing shortness of breath compared to looking back, a couple months ago or 6 months ago, that the things that they used to do, maybe they weren't doing quite as well, or that they were doing things the same as they did 6 months ago, but that still was less than where they used to be. Were they now having swelling in their legs? Were they feeling dizzy or like they might pass out doing certain exertional activities? Were there other things that they were experiencing, like they were noticing that they were having some discomfort in their chest or their heart was fluttering? All of those types of symptoms can, in the right situations, indicate that there may be something happening in terms of their PAH. And sometimes it isn't the case, but whenever a patient comes to me describing some of those symptoms, I at that time then want to be able to say, okay, from there, let's make sure we're getting objective testing. So then that brings us to what other signs. Now, first, we're talking to our patient, we're listening to what they have to say, what they're experiencing, and then we're taking that to the next step, which is looking at the objective information, meaning I'm getting a blood test to see if there's strain on the heart. I'm getting an echocardiogram to see if the heart looks different than it used to. I may be also asking people to do a walk test or get new pulmonary function tests. And if all of that doesn't give me the information I need, then at that point we may be talking about, well, let's do a new right heart catheterization so that we can directly measure the information to compare to what we had had before. So all of those things play into how we're managing our patients.